Well, I thought so. Well, the markers are really high. It's cancer.
So you're sure now that that isn't that autoimmune thing?
No, I'm afraid not. I'm afraid not. I mean, the imaging wasn't very clear, so I had to check.
Here comes the gang. This is going to be tough. You know, every time you take a lot longer when you're teaching.
Yeah, but you gotta let them learn, Sophie.
Sure, but the patients wait forever, and I can't leave until you're finished with the patients.
I know. We will try to be quick.
Do what you have to do. I'll hang around.
Thanks, Sophie.
Hey, boss. We're all done. Anybody left?
Yeah, we just have this one patient. Now, he's a follow-up, but we have to tell him about his cancer.
Oh, that sounds like some CanMeds communicator role stuff. Maybe I could do the interview and you could observe me and fill out a form for me. Dr. Programarian wants us to have some CanMeds assessments on file before the upcoming review.
Right. Okay. Well, hey, Salient. Hi, King. Hello. So this is Mr. Dysplasia here. He's here with his family because he knows that we're going to tell him about his results. Now, we don't have good news for him. He does have cancer. Now, Overly here wants to discuss things with him, and why don't you guys just observe, and we'll talk about things afterwards. Sure. All right? Now, were you here last week with Mr. Dysplasia was here? Or?
No, I was actually in the OR. Jane was in clinic.
Right. I remember now. So what do you want to do before you go in?
Well, I'd have to review the case.
Okay, what next?
Then we'd walk in and introduce ourselves and try and set the scene for delivering some difficult information. We'd have to give them some time to process the information and ask any questions they might have.
Okay, that sounds good. All right, so let's review the case here. So that's what we have. Does anybody have any questions?
Nope, the patient's waiting. Let's go.
Well, it depends, I guess. Oh, here they are now. Okay. Hi. Hi there.
Hi. Hi.
Get right. Audio.
Fine. Yes, absolutely.
Hey, good to see you again.
Hi, Mr.
This is Mr. Severe Dysplasia. This is his wife, Mrs. Dysplasia, and their son, Mr. Mild Dysplasia. And they travel from Buffalo just to meet with us today. Thanks for coming.
Very nice to meet you all. My name is Dr. Eager. I'm the chief surgical resident. I work with Dr. Cut It Out. This is the rest of our team. I understand you're here to talk about your test results today. Is that right? Okay. Yeah. Well, let me just take a quick peek through your chart here. Yes. Well, we've had to expand our investigations quite a bit because of your, inconsistent presentation, let's say. Just taking a look at, you've really given us a lot of extra work to do here. First, let me just say that your test results are positive.
What do you mean by positive?
Well, let me start over. Let's just back up for a second. Let's go step by step here. It looks like you first came in with some jaundice due to a biliary obstruction, and then you had a stent inserted, and the jaundice abated.
Yeah.
And then you had some brushings of your CBD, which were equivocal, of course. And then a CT scan was arranged, and that looked like it was consistent with a tumor, but maybe left some doubts. So you had a funny-looking pancreas as well. That raised the possibility of a rare diagnosis, and Dr. Cut It Out ordered some extra tests to rule that out. If that test had been positive, we could have treated you with just some steroids, but it looks like that test was actually negative, and then the test for cancer was positive. Long and the short of it is, it looks like that lump on your CT scan of the pancreas does turn out to be cancer. But the good news is we can take it out.
You mean he has to have surgery? It's a really big operation everyone's been talking about?
Yeah, but he's okay for that.
Mrs. Dysplasia, do you remember the operation that we talked about last week?
Yeah, we have those diagrams you drew us.
Right. So what the situation here is that, unfortunately, it is not good news. We are pretty sure that this is a cancer that we are talking about. But the positive aspect is that it looks like it's just confined to the pancreas, that it doesn't affect these big blood vessels that run near the pancreas. And what that means is that surgery is possible. And surgery really is the strongest way that we have of treating this cancer. And Mr. Dysplasia, you are strong enough to deal with this surgery. All right, based on your health, that is.
Is there any way to cure it?
So that's a review of the situation. Yeah, I hear that you are scared about the surgery and that you're worried about your cancer. But it's going to be all right. I remember last week you were telling me you were looking forward to traveling and spending time with the grandkids. And that sounded like a very valuable thing to look forward to. Is that still your goal?
Yes, it certainly is. Just a couple of days ago, we were talking about that and making some plans.
You know, I think this means that, we have to go forward with the surgery. Surgery is going to be the only way that we're going to get rid of this thing because there's no other way out, right? And we're not giving up. We're going to go forward here. So we need you to tell us what the next steps are.
Good.
Are you guys done yet?
Yeah, Sophie, thank you. Here's the consent form here. I told the patient and the family that they were asking for some information that I told them that you would be able to provide them. And thank you for staying. I'll see
Okay.
you tomorrow.
All right, I'll go deal with the patient and see them out, and then I'll see you tomorrow.
Great, thanks.
Night.
So overly, how do you think that went?
There was a lot of emotion there. I wasn't really ready for that.
Okay.
I don't think they were understanding what I was saying at first.
No, not really.
And I don't think they were ready for me. I mean, I know I'm new, but I
Yeah.
think they were expecting you.
Look, I could probably have set that up better for you. Now, we were breaking some bad news here. The patient and the family, they were scared and surprised to learn about the cancer. There's actually an article called Breaking Bad News in your online clerkship manual. Why don't you guys have a look at that? Come back tomorrow, we'll have a chat about things. I'm sure you'll have some questions by then that we can address. And we'll go from there. And I'll ask you guys to tell me about the framework of communicating bad news to patients, okay? So if everything's done, you guys can head out. Why don't you and I head up to the ward and
Okay.
you can tell me a bit more about what you thought of that interaction and I'll give you some more feedback, all right?